Hi, I'm Dr. Molly with Your Goals Physical Therapy. Recently, I ran into a woman who was suffering from knee pain, and her question to me that prompted this video was, why should I go to physical therapy when I don't have a diagnosis? So let's go back a little bit, and I'm going to talk to you about how I originally met her, and then I'll tell you what my answer to that question was. Originally, I met her just in the course of my usual day. So she's not a client. She's just somebody who was talking about how bad her knees bothered her. And so what she was describing and where she was on this path, she said that she already had a doctor's appointment. So she was going to go and see what the doctor was going to tell her about what was going on in her knee. A few weeks later, I run into the same woman. I say, well, what did your doctor tell you? And she goes, nothing. He did x-rays that came back with nothing on them, and then he was going to send me for an MRI. But basically all he did was offer me anti-inflammatories, and then he told me to go to physical therapy. And I said, well, that was actually pretty good advice. Obviously, you should go see a physical therapist. And she goes, well, why would I see him or go make a therapy appointment when I don't have a diagnosis? I don't actually know what's wrong with my knee. So my answer to her was that, when you go see a medical doctor, their job is to kind of look at your whole internal structure. So they want to see on an x-ray or an MRI if there is any reason for a surgery or if there's any reason to give you medication. And so if your doctor is suggesting that you go see physical therapy, or even if they're not and they're just saying that your knee is fine, what that means in that context is that you don't need to worry about having a surgery because there's nothing there that indicates that you need surgery. And if they're not offering you medication, then it means that they don't see any inflammation or anything inside that joint that tells them that they need to help you with a pharmaceutical to get rid of the pain. Now, for some doctors, they never suggest physical therapy, and for others, they do. In both cases, physical therapy is definitely an option, and I, with my huge bias, strongly suggest going to see a physical therapist. And this is my big push for that, is that no matter what is happening, this person, it was her knee, so I can give a very specific example. She's having problems bending, like she can't bend her knee. She has problems when she walks for really long times. She has problems standing at the grocery store because her knee just starts to bother her, and then it starts to feel like it's going to give out. This problem for her has been lasting for several months. It's just slowly getting worse and worse until it prompted her where she would go to the doctor. So now she's sitting in this space where she's like, they're not telling me what's wrong with my knee, and they've looked inside of it because they've seen an x-ray. They were going to send me for the MRI, and then they decided not to. So this is where she's sitting in her mindset. She's like, so what's wrong with my leg? I'm going to go someplace and they're going to be moving things around. How dangerous is that? So what I was able to tell her is that when a physical therapist does an evaluation, they look at your whole body also, but we're going to be looking at how you move. We're going to bend the joint. We're going to test your muscles. We're going to test the ligaments. We're going to be doing all these hands-on tests to see what the quality of your motion is and what is going on with your joint, and also what's going on at the joint above and the joint below. Specifically with knees, it's very rare. I would say that it does not happen that if you have a knee problem that you do not also have something going on in your ankle or your hip. And just me saying that to this young lady, she's like, oh yeah, I roll my ankle all the time. It's like a weekly thing. I roll my ankle, it swells up a little bit, and then it's fine. And she's like, and when I was in high school, I did do something to my hip, but I don't remember what. It went away after a little bit. And I was like, well, those are things that the therapist will be able to help you look at. Look at just how everything else is affecting your knee, not just your knee, because your knee could be having pain because something else is putting stress on it. And she's like, oh, okay. So they're actually going to put their hands on me and like really feel around and tell me what's going on with the muscle and the joint. And I was like, yes. And so no therapy is going to do anything so aggressive that they injure you. Just moving your joint, if you're able to walk, can't hurt you. So there's nothing in a physical therapy assessment or evaluation that could be harmful to you. And the nice thing is, a lot of the hands-on tests are diagnostic. Not medical diagnostic in that sense, we'd have to send you back to a medical doctor, but we can tell if there is some form of ligament that needs to be assessed, with a MRI. We can see if the inside of the joint is stable enough that the likelihood of any kind of ligament damage is not there. There's lots of things that we can do with our hands-on assessment that not only tells us how we're going to treat you, but rules out anything that could be devastatingly going on in that joint. So after our conversation, she felt a whole lot more comfortable going in and seeing her local therapist. Unfortunately, that was not me. But anyway, so somebody else was so much closer to her house. So she went down there and she was like, oh, I feel so much better. I just knowing what's going on, and that, really was something was, going on in my hip. They did a few things, and just leaving the eval, I felt so much better. And she's like, I'm so thankful that you came and talked to me. So I just wanted to, kind of share that, because I don't think she's the only person that's ever wondered, but if I don't know exactly what's going on with my knee or my body part or what's going on, then how can I go to see physical therapy? Because they're just going to have me move around, and won't I possibly injure that? And that is not the case. We physical therapists will do a full assessment, and the idea is to come up with a root cause of the injury and then help you with treatment. But just moving that joint is definitely not going to injure you. I hope that this information is very helpful and it helps you make the decision to go see somebody sooner than later, because it's always easier if you see somebody sooner. You have a good day.